Cholesterol is a waxy substance found in your blood. Your body needs cholesterol to build healthy cells, but high levels of cholesterol can increase the risk of heart disease. And that's because when you have high levels of cholesterol, you can develop fat deposits in your vessels. And eventually, these deposits grow, making it difficult for blood to go through your arteries. Sometimes these deposits can break suddenly and form a clot, which can ultimately cause a heart attack or a stroke. Hello and welcome back to Dr. Solar channel. This is Dr. Fatima and today we are going to talk about high cholesterol and its natural treatments based on recent articles. So let's go! Cholesterol is used by all the cells in your body to keep them healthy. It is carried around your body to the cells that need it by proteins. Proteins are substances in your blood that do most of the work in your cells and help keep your body's tissues and organs working as they should. When cholesterols and proteins are combined, they are called lipoproteins. There are two main types of lipoproteins in your blood. One is good for your health and the other is bad. High-density lipoprotein or HDL is known as the good cholesterol. The good cholesterol takes the bad cholesterol that you don't need anymore to the liver, where it is broken down and removed ultimately. Low-density lipoproteins or LDLs are the bad cholesterol. If you have too much LDL in your blood, you will develop fat deposits on the wall of your vessels. These deposits narrows your blood vessels and increases the risk of heart attack and stroke. You also have another type of fat in your blood called triglyceride. The high levels of triglyceride also contributes to narrowed blood vessels. Having excess weight, eating a lot of fatty and sugary foods, or drinking too much alcohol can cause high triglyceride levels. Dyslipidemia means that you have unhealthy levels of one or more than one of these fats in your blood. So if you have dyslipidemia, this means that you probably have high levels of LDL, high levels of triglyceride, or even low levels of HDL. Okay, now that we know a little bit about the types of fat, let's talk about the symptoms of dyslipidemia and its treatments. The problem is that you could have dyslipidemia and you never know it because dyslipidemia has no obvious symptoms. But if you don't diagnose it early and don't start treatments, it can lead to heart attack and stroke. But there are some risk factors that kind of tells us who is at higher risk of developing dyslipidemia. So if you're overweight or you have a big belly, you have diabetes, or you generally don't have a healthy lifestyle, which means you don't exercise a lot and you don't eat healthy, you eat sugary and high-fat food commonly, you might want to consider asking your doctor for a blood test to see if you have dyslipidemia or not. Okay, now you might wonder, what are the normal levels of cholesterol? Here I have provided a table which shows the general normal levels of cholesterol, but it's just general because the normal levels of cholesterol depends on your health status and your age. Okay, now let's talk about the treatment options for dyslipidemia. A systematic review article evaluated the effect of different natural treatments for dyslipidemia. In their article, they introduced the most effective foods that could help lower the cholesterol. The first one is canola oil. Studies suggest that if you use canola oil for 30 days instead of other types of oils that you use commonly, your triglyceride and your LDL starts to decrease. The second suggestion is tomatoes. Studies show that if you add 300 grams of tomatoes to your meal every day, it can help decrease your LDL levels. You can add it to your meal or just drink it as a juice. The next suggestion is avocados. Avocados are a great source of different nutrients such as monosaturated fatty acids. Studies show that if you eat one avocado per day, you can significantly help your body to decrease LDL. Almonds are also high in unsaturated fat. Studies report that if you take around 45 grams of almonds, you can decrease your LDL levels as well as increasing your HDL levels and therefore protect your heart health. Another nut that is really beneficial for your heart health is walnut. Walnuts have high levels of omega-3 fatty acids and therefore they can help you protect your heart health. Studies show that adding a fistful of walnuts to your daily diet can decrease the bad cholesterol in your blood. Another nut that is beneficial for treating dyslipidemia is hazelnut. If you take around 30 grams of hazelnuts for 1 to 3 months, you can decrease your LDL and triglyceride levels. Flaxseed is another option for lowering your cholesterol. Adding 38 grams of flaxseed to your daily diet can significantly decrease your LDL levels. You can use it both as a flax drink or a flax bread. One serving of flaxseed provides a good amount of protein, fiber, and omega-3 fatty acids. It may help lower the risk of some cancers, help maintain a healthy weight, and reduce cholesterol and blood pressure. And my last suggestion is soy proteins. Eating about 25 grams of soy protein every day for 6 weeks can help you decrease your LDL levels significantly. And here I have provided the figure of this article so you can see for yourself what you should eat and what you should avoid to treat your dyslipidemia. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And if you have a medical problem, I'd be happy to answer it in the comments. Bye!